Hello, welcome to the latest from Iguacu, your trusted source for effective overseas giving at weareiguacu.org. Thank you for joining us. I'm Catherine Davies, the CEO and founder of Iguacu, and we'll shortly be joined by our lead researchers, so please feel free to post a question about anything to do with the world of Iguacu. Perhaps you're curious about the latest developments in any of the serious humanitarian crises around the world that we cover, or perhaps you have a question about one of the charities we recommend, or what we do at Iguacu. Feel free to post a question during this recording or afterwards through our social media. Thank you very much for joining us, and I will attempt to bring on now our first researcher to join us, who I believe is going to be Blondine Sidinier. Thank you very much for joining us, Blondine. And Blondine is our lead researcher for South Sudan and Central Africa, followed by Adib Chowdhury, our lead researcher for natural disasters and disaster resilience around the world. Blondine, thank you very much for joining us. How are you?
Hi, Catherine. Good, and you?
Very good. Thank you. Thanks very much. And you have some news for us this week from South Sudan.
Yes, I am pleased to report that more than 200 child soldiers, some as young as 14, were safely released in the south of the country. It is the second time a large group of child soldiers has been freed so far this year. Since a conflict broke out in 2013, it is estimated that more than 19,000 children have been forcibly recruited into armed groups. On another note, I am also very pleased to announce that after conducting an in-depth investigation on South Sudan, we now have a recommended charity in the country, which is the Norwegian Refugee Council, or NRC. NRC has been operating in South Sudan since 2004. A network of experts on the ground have commented their high level of effectiveness in the field and their capacity to adapt to the changing environment in South Sudan. NRC employs more than 250 staff in South Sudan, including 231 local people. NRC has offices across South Sudan and mobile teams ready to deploy when new and sudden emergencies arise. NRC provides food and helps people recover their livelihoods. They also ensure communities have access to safe drinking water. They provide shelters, offer education programs, and help the vulnerable uphold their rights. If you want to know more about NRC and their programs and activities in South Sudan, please visit our website at weareiguacu.org.
It's an exceptional operation, the South Sudan operation of NRC, and it's been highly regarded by our expert network. So thank you so much, Blondine. Blondine's conducted an investigation over several months and speaking to a great many experts on the ground. And now it just takes seconds to donate to the people of South Sudan effectively through Iguacu at weareiguacu.org. So fantastic work, Blondine. Thank you.
Thank you, Catherine. And also, it is a restricted appeal. So when you donate through us, you make sure that every penny you give goes to South Sudan.
Thank you, Blondine. And do you have some news this week from the Central African Republic?
Yes, 5 displaced families living in a camp in Bangassou in the southeast of the country were able to return to Bangui, their area of origin. They were passing by the region when clashes broke out in May 2017 and had been since unable to return to their homes. More generally, people from Bangassou are still unable to move freely in the city. Also, tensions across the Central African Republic remain extremely high since a disarmament operation in the capital 2 weeks ago. Several armed groups gathered in the north of the country and threatened to retaliate against the government. And we will keep you updated on that issue that we are following closely.
Yes, it's a already difficult situation in the country, and now it's at this high point of tension, and we'll know more next week.
Yes.
Thank you for that update, Blondine. Until next week.
Thank you, Catherine. See you next week.
See you then. Bye for now. And we'll move now from South Sudan, the Central African Republic, to the world of, I can't quite, there we go. I'm just bringing on Adib Chowdhury to join us to talk about the latest in the world of natural disasters around the world, and also Adib monitors resilience and prevention when it comes to natural hazards and disasters. And here you are. Hello, Adib.
Hi, Catherine. How are you doing?
Very well, thank you.
Good.
May I ask you what news you have to share with us this week?
Yes, so this week I have news from the island of Vanuatu. Vanuatu lies in the South Pacific Ocean, just northeast of Australia. And according to the Vanuatuan government, thousands of islanders are going to be resettled to nearby islands by the end of May. And this comes following activity from the island's most active volcano, Mount Monaro. A state of emergency was issued last week when islanders began to show symptoms of respiratory illnesses. And to make matters worse, crops were being buried under layers of ash. And compounding the situation was the fact that food stocks began to dwindle as supplies halted, and the local sources became contaminated. And currently, negotiations are currently underway between landowners and the central government as to where to resettle them, to resettle them to the island of Mayo or Pentecost. And those are the two nearby islands. And so this resettlement is expected to take place by the end of May.
And what do we know about the volcano, its activity, or generally speaking about the vulnerability of Vanuatu? Can you share anything about that generally?
Yeah, sure. So the volcano has been active, actually, in fact, since last September. And before that, prior to that, it exploded a good couple of decades ago, and it was a massive explosion. So since last September, it's just been going on and off, and matters have gotten so worse that, the agriculture in the area, it's a very agriculture-dependent island. It's very fertile land because of the volcano. But, this is also a blessing and a curse at the same time, unfortunately. And the government has just decided that it's better for the islanders to be relocated.
Great, thank you. Thank you so much for that report, Adib. Until next week.
Excellent. Thank you. Take care. Bye-bye.
Thank you. Bye. Next we have joining us today, I believe we should have Nathaniel Cherokee, and I'll give him a chance to join. I don't appear to see him being able to connect right now. Just where he is, it's not the best internet connection, his part of the world. So we're just waiting to see if we can connect. Whilst we're waiting for that, I have some news here from one of our researchers who is a lead researcher for Haiti, and she just sent me an update as she's unable to join us today on the latest from Haiti. And it was really an update on our recommended charity in Haiti, Partners in Health, and one of the reasons why they are our recommended charity. So our network of experts for Haiti report that health and education are the two most important humanitarian needs in Haiti at the moment. And Partners in Health, our recommended charity, is helping to make a tremendous difference in the lives of Haitians by building a resilient healthcare system. One of the many qualities of Partners in Health is that almost all of its staff are Haitians, which means Haitians are not only the beneficiaries of healthcare, they are also trained with top-level healthcare training to become the next generation of nurses, doctors, surgeons, and community health workers for their own community. You can find out more about Partners in Health, why they were recommended, and how to support them at weareiguacu.org. Thank you so much for that, Kirsty, and I'll just see if I can find Nathaniel to join Nat, and here I believe we're having some success, and he'll have some news for you on Syria. the latest on Syria. Hello, Nat. How are you?
Hi, Catherine. How are you?
Very well. Would you like to share your update on Syria?
Sure, yeah. So now a lot of the humanitarian needs are now concentrated in the northwest of the country, near the province of Idlib, where forced population displacement and violence is overwhelming the local capacity to respond and the coping capacities of charitable organizations present there. They urgently need more resources to be able to help people, especially people coming from Eastern Ghouta and from other parts of Syria. Close to it is Afrin, also in the northwest of the country. It's the heart of the confrontation between Turkish forces and Kurdish forces, and according to humanitarian actors, if this continues that way, in the coming month, we will have close to 300,000 people there in need of life-saving assistance. There's an area of Syria that's much less in the spotlight. It's in the south of Syria, south of Damascus, southwest to be exact. It's a zone where the opposition is still present, and there is a de-escalation agreement. It's a kind of ceasefire that is still holding for now. There are fears that it might end soon, but for now it's holding, and our recommended charity SAMS is on the ground. The needs are critical there. You have 300,000 people that have been displaced. It's 1 in 3 people in this area. So the needs are really significant, and our recommended charity SAMS is helping run one of the major hospitals. Throughout the month of March, they have treated 10,400 patients, including 4,000 children. And every month, in average, they manage to provide 100 surgeries. So it's invaluable in a context where access to healthcare is, as you can imagine, extremely limited.
They're doing an amazing job in extremely challenging circumstances. And SAMS, you can donate to SAMS through weareiguacu.org. It just takes a minute, and your help would be greatly needed and appreciated. Thank you so much for that, Nat. Thanks for the update, and we'll see you next week.
Thanks. See you next week.
Thanks, Adi. Thanks, Nat. Sorry.
Bye.
Bye. Very good. Unless you have any questions, and I'll just double check to see if you do. They are very welcome. And I think that there are no questions for the moment. One of the common questions we get asked at Iguacu, so I'll take an opportunity to answer this right here and now, is why is it that we do this extensive investigation on behalf of the public, and we find out these highly effective charities in serious humanitarian crises? And well, firstly, we do that because we know how challenging it is for the public with limited time to be able to find out this kind of information for themselves, and we know that this is information that they highly value. So that's why we do it. But why would somebody donate through Iguacu rather than through the charities we actually recommend? Well, the main reason for that is because at Iguacu, when we speak to a charity that has been highly recommended by our network, we explain to them that anyone who donates through Iguacu, the Iguacu donor community, donates to that particular operation that's been identified as highly effective by our network. Because all our investigations are context-based. They're based around each crisis. We have an entirely different investigation because every crisis is completely unique. It's affected by so many different variables on the ground: religion, climate, politics, economics, the history of other crises, the terrain. There's so many different dynamics that make it unique. So we have this completely locally based investigation and speak to a wide range of experts and with great knowledge about what's happening on the ground. So when they come up with when they come up with, there's a consensus about a short list of names that keep coming up from the network. These are the really effective operations dealing in the heart of the crises, dealing with the major humanitarian challenges. Those operations refer to that operation of what might be a global charity. They're not referring to the charity's operations around the world. So in South Sudan, our investigation is looking at the South Sudanese operation of global charities when it's a global charity that's in the shortlist. So what happens with global charities sometimes on the internet, when you're searching on the internet for effective charities for a particular crisis, many of them will display a particular appeal. And that appeal, when you donate to that appeal, sometimes the money goes to their global pot. It goes to all of their operations worldwide and not specifically to that operation. So because our investigations are rooted in particular operations, particular crises, based on all the knowledge that we have on that particular crisis, it's very important that when people donate through Iguacu, they only donate to that national operation and not to the other operations of a global charity. Now, global charities do this for good reason. The reason why they have global pots is because sometimes there's crises in the world that are underfunded, that don't get the publicity of the media, they don't get heard about, people don't know about them, and there's serious need. And so they have this global pot so that they put the appeal up for a particular crisis, but they use the flow of funding to help support all of their crises, because some of them are seriously underfunded. They don't get the attention whilst the need is still as severe. So it's often for good reason that the global pots exist. But at Iguacu, what we care most about on behalf of the donor, on behalf of the public, is which operation in this crisis is highly effective, because that's where the public wish to donate their money. They want to donate the most effective charities. They want to donate to charities that are addressing the heart of the crisis and not somewhere on the fringes. They want to really reach out to people in great need around the planet, and they want to reach out to them effectively. So that's why we restrict appeals. So that's why people donate through Iguacu. And we also cover those crises in the world that are less known, that are underfunded, that do not get much media attention. For example, we cover the humanitarian crisis in Central African Republic, and we currently have an investigation underway on the DRC, the Democratic Republic of Congo. So that's enough for now, I think. I just wanted to share that with you. It's a very common question we get, and we look forward to any of your questions. Don't hesitate to get in touch with us anytime. And that's all for now. Wishing you a great week. Bye for now.